I must thank the organizers for such a lovely show here in Goa. And I like the idea Dr. Varghese propounded. He said that this is going to be more of a clinical nature conference, then more of, it's going to be more interactive. So on this note, I welcome all of you. I'm also part of our organizing committee. You have come from all the nooks and corners of the country for such a wonderful conference. And we had such a beautiful sessions in the morning, which has made my work very easy. Before we start, I would like to ask you, the topic of discussion and consideration is amygdala and its role in sexual dysfunctions. So I have a simple question. How many amygdalas are there in the brain? You may raise your hands. Please go ahead. Correct. Someone else? Please go ahead. This is an open session. Here is nothing is right and nothing is wrong. And it doesn't matter even if I'm wrong or you're wrong. So I got some answers from the audience. Some said 4, some said 1, some said 2. The real answer is we have 2 amygdalas. So that is why it is called amygdala. So this is so important. I'm a dermatologist by practice. I'm practicing dermatology for last 30 years, 35 years. But what has drawn me to neurology, right from my MBBS days, I was interested in neurology, psychology, endocrinology, and psychiatry. So I got a chance post-COVID to study more of a neurology. And so I have diversified myself into dwelling into a most difficult area of neurology as far as our MBBS days goes. I think you all will agree with me, isn't it? Thank you. So today, before we discuss about amygdala, I would like to have a couple of case presentations to you. I want all of you to think that you are sitting in your consulting chamber and you have got a patient who has come with this history. This is a history which is written by the patient over the period of last 1 year. 6 pages. I'm not going to read all 6 pages. I will be reading only some of the relevant points to you as a doctor to infer what could be the cause of his illness, or what is the likely cause, what is the likely diagnosis, and what advice you are like to give him. So I'll give a brief history. This boy, 35 years of age, he wanted to lose his virginity. So he gets an online appointment with a commercial sex provider. He intimates with her in a hotel room. And during the course of intimacy, he does not have a peno-vaginal sex. He just has a oral sex, but just immediately after oral sex, he starts feeling very guilty about the act. And suddenly, he chokes up, he starts sweating, and he refuses to have further interaction. That episode happens somewhere in 1st January 2020. After that, after what happens that day, he gave me this history. He says that same day he developed some rashes on his tongue. Now I want you to pay attention to this clinical presentation which he has given to me, date-wise. So on 1st Jan 2020, an odd sensation on the tongue developed. Couldn't eat much of the food. Small tiny red spots on the tongue. Lasted for 10 days. Then after 15 days, the tongue turned white. After 2 weeks, slight headache on the right side. That is, see the chronology. He has already had 1.5 months of exposure. Slight headache on the right side of head. Pain in ears. This is what he has written. Then 15 days after that, he started getting loose motions. White lines on nails. 10 days after that. Rashes on the body, 15 days after that. So by that time, he's 4 months of exposure period. shivering and cold. Couple of weeks back. That is what he has written. Shivering followed by fever. That's 4 months after the episode. Night sweats. I wake up at night and saw myself drenched in sweat. The pillow and blanket were wet. The bedsheet was also wet. The AC was on. Pain in stomach. He said he never experienced pain before. Has taken places left and right side and center of lower abdomen. Feels like a kind of knot intermittently. Sore throat few days afterwards. Lot of mental pain. Night sweats, nail changes and dryness of mouth. So you have this brief history of this patient, 35 years old patient wanted to lose his virginity, and he gives you this symptomology over the period of last 6 months, 6 to 7 months. So what is the likely diagnosis you can reach, please? Any one of you? Yes? What? It's exactly. He had. Please go ahead, sir.
Yes, because of loss of weight and white tongue and sweating, all these things, his immunity is losing. So it's a possibility of HIV infection has to think of.
This was a very severe form of anxiety. Sir is absolutely right that he had a fear of HIV. He developed a HIV phobia.
If it is real.
No, it was not real.
Then
it was not real. His tests were negative. No HIV serology was positive. But imagine his life became hell. And a learned chap, because of Chat GPT and Google, everyone is super doctors. That's the problem. But what drove him to that? Here comes our topic in consideration. It is our amygdala. What is the definition of anxiety? The definition of anxiety is repeated, chronic fear and worry about something or someone which affects that person's or that patient's day-to-day life. So this is what the world is suffering today with. More than 30% of population, especially in United States and other countries, and post-COVID, they are suffering with anxiety, GAD, generalized anxiety disorders. And who is the master regulator of hypothalamus through which all these activities takes place? That is none other than the prime conductor of hypothalamo-pituitary-adrenal axis is amygdala. In our books, we know about hypothalamo-pituitary-adrenal axis only. The idea of presenting this paper here also and the conference which took place in Hyderabad a couple of months back is to create awareness about the role of amygdala, hypothalamo-pituitary-adrenal ANS axis, autonomic nervous system, isn't it, sir? Finally, it is autonomic nervous system, both sympathetic and the parasympathetic nervous system, that affects us. Right. See, this is how we have evolved ourselves. This slide is very interesting. I'll come to it once again. This is what I have to say about amygdala. Human race is in the grip of amygdala. Amygdala, two amygdalas on deep inside the temporal lobe. And this is the most important structure of our brain because it deals with threat perception, that is fear, anger, aggressiveness and rage, motivation, behavior, sexual attraction, and so on and so forth. So fear, anger, rage, these three emotions, if you see the world today, they are so dominant. If you have a president with the problem of amygdala, the world could head towards a nuclear catastrophe. They say that a drunk president with power to push the nuclear button is a danger to the world. Similarly, if his amygdala is hyperactivated for some or other reason, what could happen? So that's why I say that human race is in the grip of amygdala. I want you to see this slide very carefully, because I'll ask you a question after the second slide. You can see a honey badger. He's fighting with whom? He's fighting with the elephant. Only animal which fights with lions, which fights with any damn animal. He is fearless. The honey badger. And there is a video, you can see this video, the elephant and the honey badger fighting. The honey badger continues to go after the elephant. And if you have heard about this patient SM, any one of you? She is known, she's a living, she's there, she was born in 1964-65 in USA. This patient SM is known as women without fear. She doesn't get scared of anything. And why she doesn't get scared of anything? Because she has Urbach-White disease, where the calcification of both the amygdalas takes place and it gets destroyed because of the gene, ECM gene mutation. She has no fear, except she gets fear of if you suffocate her with carbon monoxide, and that's not going to happen. Nobody is going to suffocate anybody with carbon monoxide, but scientists wanted to do a research on her and they found that she's known as a one who does not fear. Similarly with honey badger who doesn't fear. Why? Because their amygdalas are removed. Imagine my amygdala is removed. Both the amygdalas are removed. And you show me a lion, I have no fear about a lion. I go and fight with the lion. I don't have to fight. Lion will do the needful. I have no chance of fighting with the lion, isn't it? These are our primary emotions, and this is where amygdala plays a key role. Anger, disgust, fear, joy, sadness, surprise. We have to know about emotional intelligence or emotional brain if we want to be a very successful clinicians. My practice of 35 years tells me that it is emotion which precedes symptoms, signs, and illness. My psychiatrist friend here will agree with me, isn't it, sir? So if you want to be a very good clinician, you have to have best of the years, and you have to have an open mind. This is a circuit of our brain. This is a computer circuit. I've just taken this slide because I just wanted you to know, okay, our brain has got hundreds of billions of cells, nerve cells, neurons we call them, and trillions of connections. And it's a round the clock, millisecond to millisecond wise ongoing process. So many, not even the best of the computer could match our brain. Not even the supercomputer. This is overview of presentation. I'll skip that, but I'll go to this slide. I think this slide is a simple and most informative slide about what we are talking about. These are the amygdalas, the two white things which you, yellow things which you see there. It's anterior to the hippocampus, and those who know the neuroanatomy, it is in the uncus of the parahippocampal gyrus, which is not shown here. And this is almond shaped. There are two amygdalas. They are almond shaped. What is their weight? It is less than 4 grams, but they play such a crucial role in our body. It's known as radar or threat detector or alarm signal. It's constantly scanning the atmosphere. It is your best of the friend. But sometimes it goes on overdrive. And when it goes on overdrive, it is fast but not accurate, and we tend to commit mistakes. There are 13 nuclei. Basically, if you see hypothalamus, amygdala, thalamus, you will find these nuclei are clusters of neuronal cell bodies. And each nuclei has got a specific function. Now we were discussing about, sir discussed about same-sex attraction. So that same-sex attraction or happens because there is a preoptic nuclei in the hypothalamus. And if there is damage to the preoptic nuclei of the hypothalamus, then there is which is important in sexual dimorphism, that male and female attraction, male-male or male-female and female-male, which is normal we consider. But then it can happen same-sex attraction if the damage to the preoptic nuclei of the hypothalamus takes place. So these structures in the limbic lobe, which has thalamus, hypothalamus, amygdala, they are hippocampus. They are so important. Their nuclei are so important to understand the neurobiology also, their afferent efferent connections also, and their bidirectional effect also. These are the connections of the amygdala with the hypothalamus. It has got two main things which you have to remember. If you remember, amygdala is its stria terminalis. It's efferent, that it creates effect through stria terminalis. Stria terminalis goes around the caudate nucleus, divided into three branches: supracommissural, commissural and subcommissural branches. And then you have a ventral amygdalofugal pathway which goes directly to the hypothalamus. That is why it bypasses the prefrontal cortex. The prefrontal cortex, all our other areas of the brain which top-down effect on the amygdala and hypothalamus, the rest of the structure. But sometimes amygdala bypasses the prefrontal cortex, higher centers, and that is why you get a reaction which person repent. I shouldn't have done that. I shouldn't have said this. Why did I do it? That happens because amygdala gets triggered. Key connections of amygdala: thalamus. Afferent is thalamus, sensory cortices, hippocampus and prefrontal cortex. Efferent, hypothalamus, brainstem, autonomic centers and orbitofrontal cortex act as an emotional sensor for sexual cues. These olfactory lobes, they terminate into amygdala. And there is a sense of smell. If you sense pheromones, which plays such an important role in sexual attraction. And by the way, any one of you know, you would find most of the time that most beautiful girl is falling for some of the not so good looking boy, or maybe a sort of highly sweaty. Why does it happen? Yes. So you'll be surprised. That's such a beautiful, she's not looking at us, she's looking at someone else. Because it attracts them. Same with males. Connection with other brain regions is why I was talking about this preoptic area in the hypothalamus, which is a very important. Hypothalamus is divided into lateral and medial, left lateral and left medial, and right lateral and right medial. And they have in the regions like the preoptic region, the supraoptic region, the tuberal region, and the mammalian region. And there are so many nuclei there, and they play very important role. This we know. This also we know by now. But still, if you want, sexual dysfunction types: sexual desire, arousal, orgasmic disorders, and genitopelvic/penetrating disorders. We have been discussing this morning. Now, what is amygdala's role in sexual response cycle? Sexual motivation. Unless you get motivated, how could you have sex? Sex is in the mind, as rightly stated in that slide. It is between two ears and not between two thighs. Unless you get a drive, desire. Imagine, how could you have a sex, or you dream of having a sex? No, that's why sex is here. Then there could be any stimuli, like erotic stimuli, visual, olfactory, auditory, tactile, or even just a thought. Then arousal modulation coordinates with hypothalamus to activate parasympathetic pathways for erection. The most important function of amygdala is it coordinates with hypothalamus to activate parasympathetic pathway for erection. Emotional coloring associates sexual stimuli with pleasure or anxiety. Contextual appraisal determines appropriateness of initiating sexual behavior. The neurochemical effects, dopamine, we have to remember DOSC, dose, that is dopamine, oxytocin, serotonin, and endorphins. These are the four key hormones which are involved in motivation, in well-being. And serotonin is very important. It's a hormone of respect. If somebody says, ma'am, you so nice, you speak about, or somebody praises you, dopamine. So you feel nice. The moment you feel nice, all body chemistry starts getting positive. I unfortunately find in our country, we have scarcity of compliments. People don't compliment each other. I do not know why, but I always do. I always give compliments, and I like to give compliments, genuine compliments. People ask, you have to praise someone. Unless you genuinely praise others, how would you? They would genuinely praise you.
Sir.
So this is a very important function.
Sir, please mind the time.
Yeah. Thank you. 2 minutes. Thank you. So pituitary gland, you know by now there are two pituitaries, anterior and posterior. Posterior is also known as neurohypophysis because it is extension of neural tissues. Anterior pituitary, which secretes one of the many hormones which are so important in maintaining this. Sexual dysfunction, role in erection both as a facilitator and inhibitor depending on which part of it is activated and how it interacts with other brain regions. Amygdala, some of the key subnuclear processes, sexual clues like visual, olfactory. It determines whether the stimulus is rewarding. You know the nitrous oxide pathway, which is very important, but still I want you can take down this slide. This is a very important slide, which will give you the exact pathophysiology of erection. Same here. I think doctor had already spoken this in the morning session. Now this is important. What are the diseases which affects amygdala? Neuroinflammatory diseases, multiple sclerosis, Alzheimer, Parkinson, infection, HSV infection, human simplex viruses is very common, herpes simplex. Then you have Kluver-Bucy syndrome. Management of amygdala, this has been taught, but one thing I'll tell you, see, when you see a patient who is too restless, if his BP is within normal range, one tablet works wonders, and which is a very simplest tablet, that is propranolol, long acting. I give it to many of my patients, and they get so beautiful results. It's the pharmacological name must be known to you, but that is one of the best. It controls norepinephrine. What is norepinephrine? Morning doctor told us about hypervigilance. So in conclusion, amygdala HPA-ANS axis is key in understanding and managing the role of amygdala in sexual dysfunction and its immense significance in physical, mental, and emotional health. Before I conclude, my only request to all of you is please study about emotional component of the brain, the mental, physical, and emotional aspect of human personality, which aids in our diagnosis and treatment. And thank you, all of you, for patience listening. Thank you.
Sir, can I have one doubt, sir?
Yeah, please.
You told about the destruction of the post-optic nucleus makes them want to attract same sex or...
Yeah.
What is the reason for the destruction? Is it a genetic aberration or viral or some other infection or some vascular?
Yeah, sometimes it is genetic, and for that we need to have a lot of functional MRI studies. But this came to my notice that in a research paper that preoptic nuclei is a very important nuclei of the hypothalamus, and if there is a disturbance or damage to those nuclei, then the sexual dimorphism does not take place, because that nuclei is involved in gonadotropin releasing hormones and pubertal changes, GnRH, both release and inhibition. Correct.
Chairpersons, I'll not take more than 21.37. Sir, two observations and comments rather. Thank you for a wonderful talk. One of the observations that I want to make, and also historically speaking, like if you want to look at it, World War II, amphetamines use, the way that they could control fatigue, combat fatigue, and the fear responses that were abolished by use of German troops and British troops. That's a very important historical thing about how they messed up or how they changed the way that the fear were perceived. That's one thing. The second important thing that I would want to comment here is about the Yerkens-Dodson law, which also says Yerkens-Dodson law, which which is a law that says that small amount of sympathetic activity in the right dose also leads to excitation and arousal. So beyond that point, it starts becoming less. So, that novelty seeking and all that. So it's titrating that amount also, though fear sometimes may be there, but the fear also can produce some amount of new excitement, and the balance can there. So Yerkins-Dodson law and World War II. Thank you.
No, that's true, Miss. I agree with you that sympathetic activity is the player in, you see, there are a lot of people who are dying suddenly while dancing, while giving a speech, or you have seen so many of videos. Why that is occurring? I have been discussing with my colleagues from Mumbai. I'm not getting a satisfactory answer for last so many years. Here, the role of amygdala comes into play. Or even there is something known as anaphylaxis to stress, to sweat. That can also cause sudden death. So we have to study these particular structures in detail for betterment of us and for the society. And I agree with doctors, what you said is correct. Sympathetic activity, heart rate goes up, cardiac output goes up, you start respiration, sweating, all those things which takes place, and that makes, then you are not in control of your, emotions and actions. That is what happens. You get panicky, sweat, thirst, everything starts happening. So we really have to strike a balance between both sympathetic activity and the parasympathetic activity. And for that, we need a mental training for that, and or pharmacology. Thank you very much.
Thank you, sir.
I now invite Dr. Alka ma'am and Dr. Balamurugan sir to felicitate Dr. Tushar sir. Thank you, sir. Thank you for the wonderful speech.